In this video, we're diving into everything you need to know about choosing the right glaucoma treatment for your condition. Whether you're newly diagnosed or exploring advanced options, this is your go-to guide for managing glaucoma effectively. From understanding the basics to exploring treatments like eye drops, laser therapy, and even surgery, you'll walk away with clear, actionable insights. Have you ever felt unsure about how to make the best decisions for your health, especially when it comes to something as important as your vision? Glaucoma is one of those conditions that creeps up silently, leaving millions unaware until it's too late. If you're over 60, this is especially critical, because your sight is more than just eyesight. It's your window to independence, memories, and the simple joys of life. Imagine being able to navigate your treatment options with confidence, ensuring that every step you take is the right one for preserving your vision. Sounds good, right? But here's the thing. Most people never get the chance to fully understand their options. So what's the best treatment for your glaucoma? And how can you make informed decisions that fit your lifestyle? Stick around, because by the end of this video, you'll have the tools to take charge of your eye health and embrace a brighter future. Glaucoma, often called the silent thief of sight, is a condition where elevated pressure in the eye damages the optic nerve, the vital cable that transmits images from your eyes to your brain. This condition can start subtly, with blurry vision or reduced peripheral sight, and sometimes shows no symptoms at all, making regular eye checkups, especially for those over 60, essential. There are two main types: open-angle glaucoma, which progresses slowly like a dripping faucet, and angle-closure glaucoma, a sudden and severe flood that requires urgent care. Understanding the type you have is critical, as treatment options vary depending on the form and stage. Recognizing the signs early and taking proactive measures can preserve vision and quality of life. Diagnosing glaucoma is like piecing together a puzzle. It requires the right tools and a keen eye. The journey often begins with tonometry, a quick test where a puff of air measures eye pressure to detect potential damage to the optic nerve. Next, visual field tests map out your peripheral vision, uncovering any blind spots you might not have noticed. High-tech optic nerve imaging provides a detailed view of the nerve's health, much like inspecting a bridge for cracks. These tests work together to create a full picture of your eye health. Early detection is critical because glaucoma is progressive, worsening over time if left untreated. Regular screenings, especially for seniors, can catch the condition before it causes significant damage. If you've been postponing an eye exam, there's no better time to act. Your vision depends on it. Glaucoma treatment offers a range of options tailored to the condition's severity and individual needs. Medications, typically in the form of eye drops, are a common first step, working to lower eye pressure by either reducing fluid production or improving drainage. Consistency is crucial here, as missed doses can compromise effectiveness, and any side effects, like redness, should be discussed with a doctor. Laser therapy, a non-invasive alternative, helps improve drainage or reduce fluid production and is often recommended when medications alone aren't enough. For more advanced cases, surgery, such as trabeculectomy or shunts, may be required to create new fluid pathways. While surgery is generally a last resort, it has proven effective in stabilizing vision and preventing further damage. When choosing a glaucoma treatment, it's not just about what looks good in a medical textbook, it's about what fits your unique needs. One of the first things to consider is the severity of your glaucoma. In its early stages, medications or laser therapy might effectively control eye pressure. However, as the condition advances, surgical options may become necessary. Think of it this way: a minor leak in your plumbing might only need a patch, but a larger issue could require a full replacement. Understanding the stage of your glaucoma helps you and your doctor make informed choices. Your overall health also plays a critical role in determining the best treatment. Chronic conditions like diabetes, heart disease, or arthritis can influence what options are safe and effective for you. For example, arthritis might make it difficult to use eye drops consistently, pushing laser therapy higher on the list of recommendations. Similarly, if you're managing multiple health conditions, your doctor will ensure that glaucoma treatment doesn't interfere with other medications or therapies you're already undergoing. Lifestyle factors are another essential piece of the puzzle. If you're someone who's always on the go, remembering to apply eye drops at specific times can be challenging. In such cases, a more low-maintenance option like laser therapy might better suit your lifestyle. On the flip side, if you enjoy a quiet routine and don't mind adding a small task to your day, eye drops could be an easy fit. Tailoring treatment to your daily habits can make sticking to a plan much more manageable. Doctor-patient communication is the foundation of effective glaucoma management. Don't hesitate to ask questions about why a particular treatment is recommended or how it fits your situation. For instance, if your doctor suggests laser therapy, ask about its long-term effectiveness and potential side effects. If you ever feel unsure about a decision, seeking a second opinion can provide clarity and peace of mind. Your vision is worth that extra step. Cost and accessibility are additional considerations that shouldn't be overlooked. Some treatments, like surgery or specialized medications, may be more expensive or require visits to specialized clinics. Discussing these factors with your doctor can help you find a solution that balances effectiveness and practicality. Many communities and organizations offer resources to make treatments more accessible, so be sure to explore all your options. Another key factor is your support system. Having family members or friends who can remind you about medications or accompany you to appointments can make a world of difference. For example, a partner might help ensure you stick to your medication routine, or a friend could provide transportation for follow-ups. Treatment isn't something you have to navigate alone. Lean on the people who care about you. Ultimately, the best glaucoma treatment is one that is customized to your specific needs, health, and lifestyle. Taking the time to weigh all these factors allows you to approach your treatment plan with confidence. Remember, no two cases are exactly alike, and what works for one person may not work for another. Finding the right treatment might feel like a journey, but it's one you don't have to take alone. With the right support and guidance, you can protect your vision and continue enjoying the things you love. And to see how these factors come together in practice, let's explore some inspiring real-life success stories and expert advice. Success stories often show us what's possible, and Margaret's journey is a perfect example. At 68, Margaret, a passionate gardener, received a diagnosis of open-angle glaucoma. Initially, she felt overwhelmed by the sudden shift in her life. Her doctor prescribed eye drops, but she found it challenging to use them consistently, sometimes forgetting doses or struggling with side effects. Recognizing her concerns, her doctor recommended laser therapy. Today, her vision is stable, and Margaret is back to nurturing her beloved garden, a testimony to how personalized treatment and open communication can restore not just vision but also quality of life. Experts consistently stress one critical aspect of glaucoma treatment: consistency. No matter the approach, whether eye drops, laser therapy, or surgery, following through is vital. Take eye drops, for instance. If they're part of your routine, tying them to a daily habit like brushing your teeth or using a phone reminder can help you stay on track. It's these small practical steps that ensure your treatment is as effective as possible. Missing doses might seem trivial, but over time, it could mean the difference between preserving or losing vision. Support from loved ones can be a game changer. Imagine a family member helping you remember your eye drops or driving you to follow-up appointments. Even just having someone to talk to about your experience can lighten the emotional burden of managing a chronic condition like glaucoma. For example, a friend might notice subtle changes in your vision and encourage you to see your doctor sooner. This kind of collaboration makes managing glaucoma less isolating and more manageable. Equally important is self-advocacy. Don't hesitate to ask your doctor about alternative treatments, such as new medications or clinical trials that might suit your needs better. Staying informed is empowering and allows you to take charge of your eye health. For instance, if you're struggling with side effects, mentioning this to your doctor can lead to adjustments that make your treatment more tolerable and effective. Financial considerations also play a role, as treatments like surgery or advanced medications can be costly. Seeking advice from your doctor about cost-effective solutions or exploring resources like patient assistance programs can ease the financial burden. Margaret, for instance, worked with her healthcare provider to find a laser therapy option covered by her insurance, making her journey smoother and less stressful. Margaret's experience and expert advice highlight the importance of adapting treatment to fit your life. Everyone's circumstances are different, which is why an individualized approach is crucial. What works for one person may not work for another, and flexibility is key in managing glaucoma successfully. Ultimately, Taking charge of your glaucoma journey requires a combination of medical guidance, personal commitment, and support from your community. Margaret's story shows that with the right steps, it's possible to maintain your vision and enjoy the activities you love. But how can you start applying these lessons in your own life? So, where do you go from here? The first step is simple yet powerful: schedule an eye exam. Whether it's been a year or a decade since your last visit, now is the time to check in with an eye doctor. Glaucoma often starts without symptoms, so an exam is your best chance to catch it early and stay ahead of the curve. Make it a priority this week. Your vision is worth it. Next, grab a notebook or open the Notes app on your phone. Jot down any questions you have about glaucoma treatment. Maybe you're curious about how laser therapy works, or perhaps you want to know if your current medication is still the best option. Showing up to your appointment with a list of questions ensures you leave with the answers you need. And here's a final thought to keep in mind: your vision is your connection to the world around you. Taking steps to protect it is an investment in your independence, your hobbies, and your everyday joys. Glaucoma might feel like a daunting diagnosis, but with the right plan, it's absolutely manageable. If you found this video helpful, why not share it with a friend or loved one who might need it? And while you're here, don't forget to hit the like button, subscribe, and turn on notifications so you never miss valuable health tips. Ready to dive even deeper into living your best, healthiest life? Stick around for the next video that's about to pop up, because your journey doesn't end here.